All right, well, welcome everyone. If you are with us today or if you are going to be watching this virtually on your own time, we welcome you to our informational session on evidence-based health promotion programs for your community, brought to you by the Wisconsin Institute for Healthy Aging. My name is Jill Rankin. I'm the Executive Director for WIHA, Wisconsin Institute for Healthy Aging, and happy to be with you today to talk a little bit about our organization and what programs we have to offer. You're going to hear from several members of our team today, and they will be talking with you about several of the programs that we have available, as well as some other informational tips and tricks to getting started with these programs in your community. So we'll look at the agenda for today. We will talk a little bit about our organization and how we offer these programs throughout the nation. We'll talk a little bit about what that means, what services that we provide to all of our program purveyor, or our program partners, as we are the purveyor. And then we'll go through different specifics on the programs that we have to offer, as well as information on how to become a license holder and get started in your community. And then we'll leave some time at the end for some Q&A as well. All right, so a little bit about our organization. So the Wisconsin Institute for Healthy Aging, or WIHA as we call it, we have our mission to improve the health and well-being of all people as they age, which several of you I'm sure have the similar missions to that. We do this by disseminating evidence-based programs and practices, and we engage in collaborative public health strategies also here in Wisconsin and beyond throughout our nation. Next slide. So what we have done is we have implemented several different evidence-based healthy aging programs here in the state of Wisconsin. And through that process, we have been able to have the opportunity to partner with our academic institutions here in Wisconsin through our Community Academic Aging Research Network. And we were able to develop and disseminate additional healthy aging programs that met needs in our communities, met needs in other communities throughout the nation where there wasn't currently evidence-based programs. So what we've been able to do is develop programs packaging for those that we're going to talk to you about today. So what we do is with those developed programs, we license those to organizations throughout the nation. We also have organizations in the state of Wisconsin that are doing the programs, but we have several different states that we work with a lot of these programs. So we license those to be used in other states. We provide training and technical support to all of our licensed organizations. So it is a commitment of ours to make sure that we're providing ongoing technical assistance. And that means, of course, training on the programs, but also once someone is trained, we make sure to provide ongoing support to them about the content of the program, implementation strategies, and whatever is needed for those programs to be implemented successfully in our communities. We do provide quality assurance and fidelity oversight, as well as nationwide dissemination and nationwide data collection. So we'll collect metrics for year-end reports, and we also give those reports and those data back to all of our partners. So all of that comes full circle. So that's a brief overview of what we provide as far as all of our programs on a technical assistance level. Now let's talk a little bit about our programs specifically.
All right, thanks, Jill. I'm going to talk a little bit about stepping on and Pasando Fuerte. So for those of you that don't know me, my name is Suzanne Morley. I'm one of the health promotion program coordinators at WIHA, and I'm the program lead for Stepping On and Pasando Fuerte, our falls prevention programs. These are both high-level evidence-based programs. They're multifactorial, and they cover many of the things that can impact falls, including balance and strength, vision, home, medications, and many other topics that we'll talk about in a little bit. Go to the next slide. So the program overview, it can be delivered virtual or in person, though in person is preferred. It is 2-hour sessions every week for 7 weeks. If virtual workshops are held, there is 1 more week added to that, a session 0, just to get the participants comfortable with the technology. It does require 2 facilitators, and that can be either 1 certified facilitator and 1 peer facilitator, or 2 certified facilitators. And it's really designed for older adults that either have a fear of falling or maybe a history of falling. They live independently in the community. They may use a cane or a walker outdoors, but if they're using a walker indoors, or if they've fallen more than 6 times in the year, they may not be appropriate for the program. Next slide. So this is a weekly overview of the Stepping On program. So there are a number of different topics, like I said, embedded throughout the whole sessions. And we do invite a number of guest experts into the program as well. So sessions 1, 2, and 6, we practice the balance and strength exercises with a physical therapist or exercise expert. Session 1, it really just begins with a program overview, really getting the participants comfortable with each other and with the other facilitators. And those balance and strength exercises are practiced and introduced. Moving on to session 2, continuing to talk about the exercises as they're an important part of the program, talking about moving about safely and getting up from a fall. Session 3, another important aspect of the program is talking about home safety and home fall hazards. So a couple of different activities that go through those topics, and then also talk about pets. Session 4, we invite a vision guest expert into to talk about vision and falls, and then we also talk about footwear. Session 5, we invite a medication expert that talks about medications, and we also discuss sleep and calcium and vitamin D. Session 6, that guest expert, the physical therapist or exercise expert, comes back, and we talk about travel and getting out and about in the community and inclement weather. Session 7, we have a community safety expert come in, typically someone from the local fire department or EMS station or police department, and talking about safety strategies and talking with your healthcare provider and continuing what was learned in the 7 sessions beyond the workshop. There's also a 3-month booster that is a required component of the program. So we bring all the participants back 3 months after session 7 and talk about how they've been doing since the program ended. If anyone has had any falls, we talk through that and what happened, the different safety strategies that can be implemented, practice the exercises again, and it's just a great opportunity to review what was learned and provide some reminders moving forward after the booster is over. Next slide. The program outcomes, the research shows that there's a 31% reduction in falls. There's increased self-efficacy for behavior change. It really is a behavior change program, really getting the participants thinking about things that could impact the risk of falls. Maybe they have throw rugs in their home, or maybe they could add some grab bars, or they look ahead and scan ahead when they're walking and practice those exercises lifelong. So really just introducing those key components for behavior change. There's also a reduction in hospital readmissions, and you can see on the screen here the net benefit and the return on investment for those people that participate in the program. Next slide. Facilitator requirements of the program. So like I said, there are 2 certified facilitators that are required, or 1 peer facilitator and 1 certified facilitator. And that facilitator that's certified must be either a current or retired healthcare professional, a social worker. Typically, we see someone in the aging network, a health educator, fitness expert, or someone with knowledge of falls prevention. They should have experience working with older adults, and then also the ability to demonstrate the exercises, modify and advance the exercises as they're facilitating the sessions. Next slide. We do have a number of current license holders throughout the nation. You can see here on the screen. We do have some states that have more than 1 license holder, but you can see it's kind of spread out throughout the United States here. Next slide. All right, so then moving on to Pasando Fuerte, it's really the culturally and linguistically adapted version of Stepping On. So it's primarily the main components of the Stepping On program are embedded throughout the Pasando Fuerte program. So I'll talk a little bit about what some of the differences are throughout the next couple of slides. So again, program overview, it can be delivered virtual or in person. This program is 8 weeks, so there is an added week in there that's required. Again, 2 facilitators are required, and it is designed for older adults that speak Spanish. Next slide. This is the weekly overview. Again, you can see here, this is very similar to the Stepping On program. The same things are discussed and practiced. The exercises are practiced at each one. Guest experts are invited to present on some of the topics, the same topics as Stepping On. but things are moved around just slightly to accommodate for that extra week. And then again, with Pasando Forte, there is a 3-month booster session as well. Next slide. Outcomes again are very similar to the Stepping On program. It has the 31% reduction in falls and increased self-efficacy for behavior change and the reduction in hospital readmissions due to a fall. Facilitator requirements, again, very similar to the Stepping On program with the addition of having someone that could be a community health worker or other professional that works with Hispanic and Latino older adults. They must be fluent in Spanish, as that's the language in which the program is being delivered in. And current license holders, we just started licensing the Pasando Forte program this year. So we do have just one current license holder in Iowa, and hopefully more coming soon. And I'll pass it on to Amy.
Good afternoon, everyone. I am Amy Ryan, and I'm the other Health Promotion Program Coordinator here at WIHA. I'm so happy to be with all of you today. So I am going to be talking about the Mind Over Matter, Healthy Bowels, Healthy Bladder program, as well as the Stand Up for Your Health program. Excuse me. So Mind Over Matter, Healthy Bowels, Healthy Bladder is a program designed for women who have or want to prevent bladder and bowel incontinence. This program provides resources and tools to help women understand how to prevent or manage incontinence. And during the program, there's discussion about fluid and fiber intake, as well as Kegel exercises. And similar to the other programs, we'll go over the program overview. If you want to go to the next slide, please. Thank you. So this program can also be delivered virtually or in person. The sessions are also 2 hours long, and they meet every other week for a total of 3 sessions. The sessions are led or facilitated by one trained facilitator, and the program is really designed for older adult women with incontinence or those who want to prevent incontinence. Here is the weekly overview, so a little bit shorter than Stepping On since it's only 3 sessions. So in week 1, it includes an overview of bladder and bowel control. Also during this session, we discuss pelvic floor muscles, and we introduce 2 pelvic floor exercises to the participants. We also discuss fiber and stool consistency, and then we work through problem-solving fiber intake with the participants. And then finally, the participants set individual goals based on the information they learned during the session. And that's something they do at the end of each session, is set those individual goals. During the second session, the facilitator presents information about urinary leakage and strategies, as well as introducing a 3rd pelvic floor exercise. The group talks about fluid intake and completes a problem-solving activity during that session as well. And then the 3rd session, there's discussion about maintaining those exercises that have been learned, the fluid and fiber goals that the participant have set. And then we also discuss incontinence issues and how do we talk to our healthcare provider about those issues and get more support from our healthcare providers. And then during the 3rd session, we ask the participants to set a longer-term goal with some of these activities. The outcomes of the research has found that women who have participated in Mind Over Matter had a 71% improvement with their urinary incontinence and a 51% improvement with their bowel incontinence. So those were great numbers. And just, I think that also as the participants are able to share their own stories, that has been very helpful as well. So the facilitator requirements for Mind Over Matter, the facilitator does need to be female, and they do need to feel comfortable discussing bladder and bowel function in a group setting and feel comfortable with that. So currently our license holders, you can see on this map, are throughout the United States. And again, similar to what Suzanne mentioned, we do have some states that have more than one license holder. All right, so we'll move on to Stand Up for Your Health. This program is designed to help older adults reduce their sitting time by standing up and moving more throughout the day. So participants identify barriers to standing and discuss ways to increase their standing time. Stand up has been shown to reduce pain as well as improve functional performance and even general health. So we'll go over the program overview. This program is also delivered both virtually and in person. The sessions are 2 hours and they meet every week for 4 weeks. And then there is a refresher session that is offered at 8 weeks. Stand Up is led by one trained facilitator, and this program is designed for older adults who sit more than 6 hours a day. And here is the overview of the workshop sessions. So during the first session, the facilitator defines that sedentary behavior and why we sit. Also, there's discussion about strategies to stand and move more. And then finally, the participants set those individual goals for the next week on their plans to stand more during that week. During the second session, the group discussion includes the benefits of sitting less and what influences our sitting time. There is some problem-solving activities in this session. And then, of course, the final step is setting those weekly goals with our participants. The third session, the facilitator leads a discussion about the importance of posture, overcoming some of those barriers and confidence building, as well as the goal setting. And then the fourth session, we focus in on cognitive reframing. How can we stay motivated? What is that positive thinking? And how do we accomplish that? And then the facilitator works with the group to develop ways to stay active in their communities. And what can they continue to do? And then we have the group or the participants set some long-term goals. So all along they've been setting weekly goals. Now we're asking them to set more of a monthly or a 6-month goal. So that can be discussed during the refresher session, which is a month later. And that's when the group really comes back together and reflects on how the last month went, and they're monitoring their progress. And again, we're always asking those participants to set some goals at the end of each session. So the outcomes for Stand Up include a reduction in sedentary behavior, and the study had shown that it was by 68 minutes per day. Participants had a reduction in problems, or they reduced problems performing those daily activities. There was a reduction in pain interference and intensity, and improved functional performance, and overall health. So the facilitator requirements for Stand Up include that the facilitator has some experience facilitating groups. And at this point, WIHA is super excited to now be able to offer licenses for Stand Up for Your Health. And with that, I will pass it on to Erin.
Great, thank you. My name is Erin Eggert. I'm the Deputy Director here at the Wisconsin Institute for Healthy Aging. I handle the back end of things with licensing, so I'm just going to talk to everyone about the license holders and some of the fees and how to move forward. So this slide kind of shows the overall of becoming a license holder and the layout of that. So the Wisconsin Institute for Healthy Aging is the program purveyor, and we license the program to license holders across North America. Those license holders oversee program provider organizations where the facilitators are located. Sometimes a license holder and a program provider organization is the same organization. Other times they are at different levels. For example, if a license holder was a health department and they had an affiliate organization to work with a local senior center or similar to that, then they might be overseeing that program provider organization. And that program provider organization is where the facilitators are, and those are those individuals who reach the participants. So anyone offering these programs outside of the state of Wisconsin must hold an active license to be able to do so. So just to kind of go through our license fees for the 2024 year, our license setup is based on affiliate level. So to kind of give you a description of what an affiliate is, it is a separate organization. So come as the example I just provided with the health department working with a local senior center. So that would be an affiliate. If a health department was only training people from their health department, they would usually consider a sole license and just get that level 1. So that sole license, we do a 3-year license for $3,250. And that's for all 3 years. And then if you have affiliates, so either other organizations who you're partnering with, or if you are a statewide organization that has multiple branches across the state, then those would be considered affiliates as well. Then you would purchase based on the number of affiliates that you have. A lot of time license holders do ask that those affiliates contribute towards the license fee. So that varies by state, but you can decide that based on those discussions with those affiliates. So just a note, then this is where you would start. There is options to train master trainers, and that can help you with the sustainability of the program and further expand. There would be some additional fees if you have master trainers, but these are the starting license fees. So this is what it would be without those master trainers. To learn more, you can always visit our website. So under the For Professionals, there's a drop down that says Become a License Holder. Or you can click the link on the slide when we send that out, or you can always contact any of us here at WIHA. This is our team, so you've heard from each of us here today. Jill and myself and Suzanne, who oversees all of our falls prevention programs, are stepping on in Pasando Fuerte, and Amy, who is a great contact for our mom or our stand-up program. So we will pause for questions.
And also just to add, if you would prefer, we do a lot of in-person, I'm sorry, not in-person, but individual meetings with people. So if you are interested and you want to reach out, we're happy to schedule. Usually they last about 30 minutes. We'll just do a little orientation with your team or just yourself, just to kind of get an idea of what you're thinking of. And a lot of times we can, talk with you about which program might fit that need most, and talk with you more about the program itself and how to get started. There's lots of variances, I know, in different organizations in different states and different communities. So we're happy to work with you.
Great. I don't see any incoming questions. Again, if anybody does have incoming questions, please feel free to reach out. Our generic email is on the slide here, and we'll get that forwarded to the correct person right away. Or you can always find our contact information for each of us individually on our website as well. Thanks everyone for taking the time today to attend the webinar or to review the webinar with the recording afterwards. And we look forward to speaking to each of you, hopefully for future opportunities.
Thanks, everyone.